So currently, the overall horizon of treatment for B-cell non-Hodgkin lymphoma has meaningfully changed. A few years ago, the change was mainly driven by the introduction of autologous anti-CD19 CAR-T, and more recently from anti-CD3, CD20 bispecific antibodies. Definitely the latter seem to be able to meet multiple unmet clinical needs. As you all know, in patients with aggressive B-cell lymphoma who relapsed after CAR-T with priorly available standard treatments, the median overall survival was in the order of months. Whereas in both registration trials of either glofitamab or epcoritamab, about 40% of patients relapsed after CAR-T, and despite that receiving a bispecific antibody, less than half of them were able to achieve durable remission. So we seem to be able to induce cures even in patients who relapse after CAR-T. The rate remains low, and we're still missing biomarkers of response to bispecifics, and also we don't fully understand what the ideal assay for MRD assessment should be. So I'm currently very excited in trying to understand how we can optimize activity of bispecifics in the post-CAR-T setting in large B-cell lymphoma patients. Again, identifying optimal biomarkers that could be CD3 count that we know is meaningfully impaired after lymphodepleting chemo for CAR-T cell therapy, but also trying to understand how CD20 expression, for example, may associate with response to bispecifics. This is going to inform future combination trials where bispecifics will be able to potentially induce higher CR rates and deeper MRD eradication states. Also, we need to better understand what the biological mechanism of cytokine release syndrome is in bispecifics. While it's true that the rates are much lower as compared to what we see with axi-cel in large B-cell lymphoma, still 40% of patients do experience grade 1 CRS. There is currently a major barrier to integrating increasingly use of bispecific in the community. So trying to understand what the drivers are beyond the standard cytokines that have been explored in CAR-T cells may also inform future trials, and overall trying to increase access to bispecifics for also community oncology.